Clay Yeager has served the interest of at-risk youth for over 33 years in public life. And that's a great accomplishment. And more recently in the non-profit sectors. He's been a chief probation officer. He was the director of Pennsylvania's Center for Juvenile Justice Training and Research. And during the Ridge administration, he served as executive director of the Governor's Community Partnership for Safe Children. During that time, he oversaw the implementation of statewide adoption of the Blueprints for Violence Prevention programs in the state of Pennsylvania, the first state, I believe, to make that kind of a commitment to Blueprints initiative. And it's and I should also mention that Pennsylvania was one of the partners, the three partners in the original Blueprints initiative. That is the funding that actually got this initiative off. The Centers for Disease Control, the state of Pennsylvania's Crime Commission, and the Division of Criminal Justice here in the state of Colorado were the three initial funders for this initiative. So Clay goes back to the very beginnings of the work with respect to Blueprints. He was named by Governor Ridge as the first director of the Office of Juvenile Justice and Delinquency Prevention for the Commonwealth of Pennsylvania. He was also appointed by Governor Mark Schweitzer as executive director of the Governor's Task Force on Early Childhood Education and Care. So it's interesting to note that he actually survived 2 administrations in the state of Pennsylvania. He also developed the first national corporate-sponsored network of science-based prevention programs and served as the president and chief executive officer of the Nurse Family Partnership National Office. In 2002, Yeager was the first recipient of the Visionary of Pennsylvania Award for helping Pennsylvania to develop one of the most far-reaching and coordinated prevention strategies in the nation. He was also recognized by the Pennsylvania General Assembly for his leadership in violence prevention with the Lifelong Achievement Citation. And he's testified before Congress on the value of implementing evidence-based prevention programs as a matter of national public policy. He currently manages his own consulting firm specializing in promoting healthy development in children, families, and communities, and effective public policy through strategic partnerships with business, government, and the media. So, Clay Yeager is one of those persons who has been for most of his, or at least a large part of his professional life, pushing evidence-based programs in Pennsylvania and in other locations and nationally. So it gives me a great privilege to introduce Clay, and I'm sure you're going to delight in what he has to say.
Thank you, Del. Hello, everybody. Del, I want to thank you and Sharon publicly. We stand on your shoulders for all the work that you have done preceding us today and in years past. And I'm not sure if you've ever gotten the very public collective acclaim of 1,200 of your followers. And if everybody would join me now in thanking Sharon Mahalik and Del Elliott for the remarkable work that they do. And Del, thank you for that wonderful introduction. You know who I thought of when you were reading off all those things that I've done? I was thinking of my high school guidance counselor. He who had so little faith. And I'd like him to look around this room and listen to what you said. And all I have to say is, take a look at this, Mr. Deuceman. Something that you didn't read about that I'm very proud of is my role as dad. I have 2 kids. My son, Adam, is 20, going on 6. My daughter, Bryn, is 19, going on 40. You know how that works. It's Venus and Mars. You know, when they were toddlers, you remember when you're little kids, and those of you who are parents and have toddlers or had toddlers, and in the middle of the night, 3 o'clock, 3:30 in the morning, when they bring all of their worldly possessions over to you because they're looking for the answers to the secrets of their own universe. And when Adam was about 3 years old, you can hear it. It's the Dr. Denton shuffle. You know, you can hear it coming. He sticks his finger in my ear. Daddy! Daddy! Adam, what do you want? You don't have to yell. Adam, it's 3:30 in the morning. What do you want? Daddy, I never get any mail. Good catch, son. How about starting tomorrow, anything addressed occupant is yours? I go back to bed. My daughter Bryn, love of my life, she's beautiful, 6 foot tall. When she was about 14 years old, she hit that 6 foot mark. She was very self-conscious about it. She came to me with one of those dad moments. And she said, Dad, why is it every time somebody meets me for the first time, the first question they ask me is, do you play basketball? And I said, well, this is a teachable moment. I can take advantage of this. And I said, well, honey, it's because it's visible. It's something that's neutral. It's something that people can connect with. It's an opportunity to make conversation, ask you questions. She looked at me and she goes, that's like somebody looking at your big bald head for the first time and asking you if you're smart. You know what I said to her? I spoke the same language, the only language that she understood. I looked at her and said, duh, whatever, talk to the palm. Go away. Love these kids. On one of her last visits to America, Mother Teresa had this observation about us. She said, I find it so interesting that every time I come to your country, people want me to tell stories of babies who are dying of malnutrition in my country of India. And yes, it's true that babies die of malnutrition because of lack of food in their stomachs, but they always die wrapped in the love and affection of people in their families and villages and communities before they pass on. And I find it interesting that everybody in your country wants to hear those stories because I look at your nation and I see kids who are also dying of malnutrition. Not for lack of food in their stomachs or lack of objects in their closets, for they have many. But instead I see children who are dying of another kind of malnutrition, a starvation of the heart. Too many children are coming around and coming into this country and into this world suffering from malnutrition, starvation of the heart. I look around this room and a lot of us are of the same demographic. I think we all grew up in the same place, maybe a different address, a different zip code, but we are all products bound together, woven together, sewn together by this fabric of things called family and community and school and people. It's who defined us. It's who set the expectations. And everything that we did was wrapped in that affection and concern that was woven by the people who were so important to us. It's those things that influence us the most, have you noted? Family, school, community, the people around us. It's those things that influence children the most, and yet they are the things that children have no choice in. I look back in my own childhood growing up in the 1950s and 60s, and I know a lot of you can relate to this. In an act of true confession and total public disclosure. In 1964, I had my first experience dancing down Delinquency Drive. Several of my very clearly dysfunctional playmates came to me on Halloween and said, hey, let's go up to Mrs. Farringer's house and let's torment her. And I've always been a leader among my peers, and I thought it over for about a nanosecond and said, cool. So we went up to Mrs. Farringer's house, and we just terrorized the bejesus out of old Mrs. Farringer until she chased us around the yard with her broom, and we thought we saw her riding off into the night. The next night, a knock comes to my parents' door, and it's Chief Martin. Now, in my community growing up, Chief Martin ran the feed mill during the day, and he was police chief at night. And he came into my house, and he started snarling and spitting and swearing and threatening, and the whole time I thought, I'm not going to go to jail. I didn't think anything like juvenile court existed. There weren't juvenile probation officers that I knew of. The entire time I sat there terrified about what will these people in my community, the farmers, the neighbors, the business leaders, the people that went to my church, what are they going to think if they find out about this? But But the worst fear, and I know what the worst fear was, because all of you have experienced that same worst fear. It was the fear that was coming from the corner of the room. It was the look. Because all of our dads went to the same conference. They all snuck off and went to the same training conference back then, and they went to the same workshops. And I remember saying to Chief Martin, "Don't leave me with the look." But they did. They went to the same workshops, and I know that your dads, all of our dads went to this conference, and they attended the same workshops. Some of them are called "Stop Crying or I'll Give You Something to Cry About." You remember that? I'm too angry to deal with this now. Go to your room. And actually, when that occurred in front of siblings, it was the original perp walk. Clay's going to be in a lot of trouble later. And the most confounding to me was, this is going to hurt me, a lot more than it hurts you. And I'd say to my dad, I'm confused. But I'm proud to say that I've inherited the look and I've passed it on to the next generation. It's all about relationships. It's all about people. Connections to people in our lives matter more than anything else. And weren't we reminded of that horrifying images 7 years ago, watching people jump out of buildings that were collapsing, jumping 100 stories to their death, holding hands. One final act of living, one desperate moment, and they needed each other with only seconds to live. They need each other. We need each other. Kids need each other, need us, and relationships more than anything else. I think that children are spies from God who were sent here to measure the warming trends on planet Earth. And more importantly, they're sent here to measure the warming trends by the adults and to see how we're doing. But as we've each experienced and have seen up close in our work, there are simply too many kids who come into this world who Jim Garbarino in his book Lost Boys described as coming into the world with holes in their heart. Vast, empty holes. And as soon as they have an opportunity, they need to fill those holes. And they fill them by lashing out and dropping out. They fill them with sex and violence and drugs. They fill them with failure and doom and despair. And eventually these kids, with holes in their heart and with only a couple of things available to them, find each other. And then eventually they're dropped off in juvenile court, and we wring our hands and we shake our heads and say, my gosh, what could we have done better? What could we have done differently? I worked with these kids 30 years ago. You work with them today. We know who they are. And yet we still ignore the reality of human development, which is understanding that the content of a human being matters infinitely more than the labels or the wrapping that we attach to them. And treating just the labels without getting to the core of human substance extinguishes so many possibilities. We've all had defining moments in our careers, I'm sure. Those moments, those days, that instant, that snapshot when suddenly this life's work is more important than a paycheck. For me, it occurred in the late 1970s when a young man who I had been working with as a kid on probation came from a terribly troubled family. And our response was to keep placing him in facilities and institutions, and every time he ran away, to keep placing him in more and more secure facilities. Not understanding, no science, no knowledge, just gut, harsh instinct. But I'll never forget this day. This kid comes into my office. He's 16 years old after all of these placements, and he's sitting there in my office with his Burger King uniform on, sitting with his mother. And they were so grateful to me for all I did for them, because Jimmy was finally fixed. And he was on his way to his new job at Burger King, and thank you, Mr. Yeager, for everything that you did. And I felt like I was the savior of the universe. Until an hour later when I got a call from the police department who told me that Jimmy left the office with his mother, went home, and proceeded to stab her 47 times. You don't think that has a pretty profound impact on the idealistic nature of who we were in this business 30 years ago? And I look back now and I realize the context at the time was we didn't know any better because we were told that nothing works. The mantra that Dell referred to this morning in the 1970s was nothing works. So an entire industry was built based on the notion that really all we can do is supervise, kind of maintain, kind of keep these kids corralled in. The only science behind the work we did back then was counting days until a kid turned 18, and hoping that they got through juvenile justice, and once they turned 18, they weren't our problem anymore. We had other options. Kid came into my probation office. This is so funny. This is a true story. Kid comes in, he looks at me, and he's angry, and he's agitated, and he's looking for a fight. And he plops himself down in a chair in front of me, and he says, "Mr. Yeager, I'm sick of people pushing me around. I'm sick of people like you telling me when to get up, when to go to bed, when to eat, when to sleep, who I can hang out with. I'm sick and tired of people pushing me around. I'm thinking about joining the Marine Corps." Hey, that's not a bad idea. I heard they don't push you around there at all. I think I have the paperwork right here. We lived in the fashion industry, don't you see? Every couple of years, a new fad came out, a new fashion came out, something felt good, something looked good, and we wear it for a couple of years. Always looking down the road, waiting for the next designer to come out with the latest fashion that we could try on. In the 1970s, I lived through the era where we built youth service bureaus on every street corner based on the notion that at-risk delinquent kids are just going to stop in. Sure, these kids are going to stop in and they're going to just want to talk. And we should be able to do that to keep them from becoming seasoned, hardened criminals. In the 1980s, we took busloads of kids down to state prisons. We had these big, nasty, snarling, swearing, threatening life prisoners spit and swear at kids, thinking that the same kids whose lives had been consumed by adults who spit and snarled and swore at them from the time they were babies would somehow be scared out of a life of crime. And 10 years ago, many of us got caught up in this wave of misinformation, this doomsday forecast, that somehow there was this new super predator, this genetic mutated delinquent that was being developed, that was going to create a bloodbath in the streets of the United States. And unless we acted quickly and created systems to put more of those super predators into prisons as adults, that our communities and villages would be burned to the ground. The fashion industry, the fads. And now 2 weeks ago, we all recoiled when the Pew Foundation released its report on prison populations. 1 in 100 Americans are locked up. Should we be surprised? Thomas Jefferson observed 240 years ago, he said, if given the choice between prisons and schools, Americans will always choose prisons. It's part of who we are. We've created an industry in the hundreds of billions of dollars with no end in sight, with no boundaries in sight. Just imagine if there was a multi-hundred-billion-dollar-a-year industry that totally ignored its research and development arm. The shareholders would have a revolt. Imagine a pharmaceutical company ignoring the FDA and putting forth and continuing to put out untested, unproven products that made no impact and, even worse, made patients sicker. Imagine if we still treated depression in this country by bloodletting, drilling holes in people's skulls to let the demons of mental illness out. Imagine if 50 years ago we said to Dr. Salk, "No thanks, Jonas. we have a better way of treating polio. It remains baffling. It remains perplexing. It remains incomprehensible that 2 years after Del Elliott announced the blueprints and as much progress as we have made in this country, in some cases we haven't broken 1% of the market. In some cases we've done a lot better. And when you think about the number of kids and communities and families that would benefit from them and the disservice that we are doing to them, I guess in too many places we're still content with bloodletting. At the end of the day, it's always about people. Policy requires people. It takes the collective power of many. It takes the political will and the political courage of leaders who are willing to invest now in programs that won't benefit them during their watch. It takes us to convince political leaders that good, sound, cost-effective public policy is also really good politics. It takes the uncompromising advocacy of all of us in policy and in practice to just say no. Just say no to continuing the historical practice of funding and continuing to support the latest fads and fashions. And it takes the sometimes loud, sometimes shriekingly loud voices of all of us in this room, of practitioners and policy people, and to work through the media to educate the public that there's a better way and a more cost-effective way and a safer way to handle our children. I began my remarks by talking to you about my own children. And anyone who's a parent will understand that the day that our children join the human race is the most remarkable day in our lives. It's the day that I first understood what true unconditional love means. It's also the day that I first understood the real meaning of fear. Your heart pounds just as fast the day you drop your kids off to school. Your heart beats just as fast the day they leave the home for the first time as it did the day that you took the training wheels off the bicycle. And it never goes away. Noted child development specialist Yuri Brofenbrenner years ago was asked, what does it take for a child to develop the healthy characteristics, the long-term characteristics that we're looking for in all of our children? And he said that in order for a child to develop, they need the long-term, sustained, and sometimes irrational attachment of an adult. And when he was asked what he meant by irrational attachment, he said every kid needs somebody who's crazy about them. And so I ask, how many kids do we work with? How many kids do we see every day? How many kids live in our neighborhoods? How many kids go to school with our kids? How many kids live across the street who doesn't have anybody who's crazy about them? I suspect that we know many. We can do this, we need to do this, because it's right. We're on the right side of doing the right thing and doing the thing right. Winston Churchill reminded us that you make a living by what you get, but you make a life by what you give. And I suggest there are 1,200 people in this room who have rich, remarkable, and full lives because of what you give every day. And don't be mistaken that the science behind the blueprints and the science behind evidence-based programs somehow minimizes or neutralizes the importance of people. They still take people to give them life. Instead, the science, in my mind, elevates and affirms the importance of people. It affirms and elevates the remarkable hearts of the nurses who work in nurse-family partnership, who every day work with frightened, lonely, often teenage girls with an uncertain future and give them hope. It affirms and elevates the importance of people who volunteer their time in communities throughout the country and throughout the world to be a role model, a mentor, a friend to kids who have too few, if any at all, in big brothers and big sisters. It elevates and affirms the commitment and passion of those teachers and school administrators who have the courage and are willing to step out of the traditional role of school and offer their kids who are enrolled there paths in bullying prevention and life skills. It affirms the collective vision and wisdom of community leaders who look to the future of their children by coming together and engaging others in all segments of the community in adopting Midwestern prevention or implementing the Incredible Years or Project Toward No Drug Abuse in their communities. The science affirms and elevates the unique skills and passion and techniques of carefully trained therapists who are able to scrape away some of the deep scar tissue that hamper entire families and with whom they work in functional family therapy and multisystemic therapy. And it affirms and elevates the essential value of connecting kids to what is so essential for all of us. Clear standards and expectations and the belief that healthy families beget healthy behaviors in multidimensional treatment foster care. In everyone's life, at some point, the inner fire goes out. And then, as if by fate, it is suddenly burst into flame because of an encounter or because of another person. We should always take time to pay tribute and be grateful to those who rekindle the inner fire in each of us. And so I do. And if no one else has, let me be the first to thank all of you for what you do every day to rekindle the inner spirit, the inner fire in the lives and hearts of kids and families and communities throughout the nation and at least 11 countries throughout the world. I thank you for inviting me to be part of this remarkable gathering. Let's get at it. Thank you.